Welcome back to another episode of Boombastic Health in the Wild. With us today, we've got Bob Watson, the CEO of Health Gorilla. Thanks for being here, Bob.
Thanks for having us. We're always happy to tell the story.
Well, this story is one I have followed for years, and I'm so happy to hear that you're here. And I couldn't think of a better guest to tell a very exciting entrepreneurial story. But before we get into Health Gorilla, you were at one time a Cerner team member. What were you doing at Cerner?
So this was back in the 90s. I worked directly for Neil Patterson. We were trying to build out something that he called the connected community,
Okay.
which was our chance, his vision about how to get medical records being shared. We actually had a good demonstration in Winona, Minnesota. And what we discovered was the reason it worked is everybody in Winona was using Cerner software.
Is that right?
Was,
So it worked beautifully because everybody's on the same EHR.
Right. It was a closed environment. It worked pretty well. And then we, in those days, it was hand-to-hand combat with Epic and, Meditech.
Right.
Somebody.
And data blocking was the strategy. Get locked in, block everybody out.
Absolutely.
Right? And then you ultimately got recruited out to become more of a turnaround tech leader, or what was the...
I left Cerner, I think, in 99. How many years that is? It's a lot. It's been, 30 plus years of doing turnarounds.
Okay.
Generally prompted by an investor who was unhappy with management's performance. And for whatever reason, somebody who's a librarian by background, this is now my...
A librarian?
That's my background and how I figured it out. We run the playbook. We've done this since be the 10th time.
Okay.
And when I say we, if you look at the workforce at Health Gorilla today, almost a third of those people on your team have history. We've been together for 12 years, but everybody has history with us, so they know how to run the plays. The way I look at these is, first you have to get the right people in the right place at the right time doing the right thing.
Yeah.
Project can do on. I tend to fill those roles with people I know. Second is, let's focus in on the right ICPs. One of the challenges Health Gorilla had was they were all over the board on ICPs. So we've narrowed the ICP. So there were probably 6 or 7 ideal customer profiles they were chasing. Today, it's, I like to call it 2.5 now, and 2 in development. And the 2 we're focused on are the EHRs that aren't, obviously have big concern and e-clinical work. So everybody knows, for example, that we're the backbone behind Meditech's interoperability stuff. So that's one. The other was value-based care and digital health. Value-based care is the data that we can provide to those people who have risk around Medicare Advantage programs. And then our half ICP is we have our own private lab network, which, to be honest, I keep trying to kill it. Every time I kill it, the sales guys sell something, so can't kill it. And then we have 2 ICBs in development. One around individual access service, which is one of the 2 currently approved TEFCA use cases.
Okay.
And
TEFCA has been a federally sponsored program, right? It's a way to try to fix this interoperability issue and help.
But with no teeth in it.
Okay.
And that's why adoption was slow. Now, if I look at our traffic, the cumulative traffic this year has gone up 3, 4, 5-fold from what it was last year. So those legacy networks still get hit.
Right. Okay, I got it. And so we dove right into there. So at a high level, Health Gorilla is addressing this interoperability issue, and it was around before TEFCA, and TEFCA has become a tailwind now that they're putting some teeth into it. And at the end of the day, how this works with your model is you're helping to facilitate the access of patient information by caregivers. And when a caregiver accesses the information, their system contributes back to enrich the overall shared record. Is that right?
Right. The reciprocity piece that's really cool about it is if you take data, you have to give data.
Right.
You can't just be a taker. You get a request. You actually have to answer. And there's been some information blocking, some lawsuits about it, but we fundamentally believe if the current administration stays on the path it's on, it's going to create massive tail for the kinds of products and things that we do. in some ways, it actually feels like what happened in 2014, 2015, when the federal government started to incentivize providers and hospitals to use electronic medical records. Look what happened to those companies. I think this is a moment we're on the edge of a blossom.
Yeah. So you're talking about the HITECH
Yeah.
Act?
Yeah.
So is there an analog to that from a funding perspective where there's a government funding mechanism to support this?
I don't think they're going to start with funding.
Okay.
So what they will start with is putting teeth.
Hmm.
What I mean by that is there are going to be penalties.
Okay.
And those penalties can be severe.
If you block and don't participate in this program, which is to the detriment of patients, you will get fined.
Yep. Look, the way we talk about it internally at Health Gorilla is we want to deliver to the end user the best, cleanest, deduplicated, AI-ready data so they can run their AI on it to do what they want to do it. We want to deliver to them in a format that's actionable. It's at the end of the day, not only is there a physician at the end of the pipe, there's a patient. There's somebody who needs care. And I'll tell you my own story. When I moved from Atlanta to North Carolina, I manually filled out all these release of information forms. There's one health system that still is not delivering my records.
No kidding.
They're delivering, they send the visit notes, but not the whole record. I do a better job of getting data from my pharmacy. 5 surgeries in 3 years. So that information is important.
Right. Yeah.
You know, it's frustrating. If they put teeth into TEFCA or the CMS aligned network, whatever you want to call it, and put punishment in there, people are going to start sending the information. Now, the next phase, you know, in my mind, the next phase is, okay, that's working, but we might need to incentivize. So at some point, there may need to be some economic incentives.
Well, and it's a different animal as well, because I think with the EHR, the kind of infrastructure you had to deploy in every single healthcare system, this type of approach with Health Gorilla, there's not, you've got the infrastructure out there. So to enable it at the endpoints, people just have to participate.
They just have to participate to enable the endpoints. And then it's also about how you deliver the data. So if you think about a physician, who's got 8 minutes to visit a patient, he's probably going to spend a couple of hours every night before he goes in reviewing the records.
Right.
We want to deliver it to him the way he can consume.
Yeah.
And that's the point. It has to be consumable. If it's consumable, it can be actionable. Outcome, better patient care. That's what I want to see happen.
Yeah.
Better patient care.
Right. Right. And so you think about all the gaps that happen in people's care because the data is gaps, right? And so how would you sense and respond and be proactive and predictive and prevent things? With this, the idea is no matter where you've had your care, when I say this, I mean this overall strategy, and it's no matter where you have care delivered, you should have this uniform record that any other caregiver is going to have access to, right?
And you should not only have that data, but you should have it in a format that you can use it. Some of the people in this industry just deliver blobs of sense data.
Right.
Now, granted, they're the low-cost player. We are not the low-cost player because we do more with the data.
Yeah, right.
Fine. Never want to be the guy at the bottom.
Yeah, well, and historically, data has been sort of in that world where you have these marketplaces and stuff, and they just kind of dump data everywhere, and it's just sort of a swap meet kind of thing. In this case, we're talking about highly curated, enriched, accurate data. And you touched on the age of AI that we're entering into, have entered into now. Everything is about data. How do you have the right kind of data to train models and create better care? And the Health Gorilla model is very much around having that high-end data that has the certitude to truly be utilized in AI. Is that right?
I want it to be utilized. What I don't want to hear from the client is, you gave me too much data, or you gave me dirty data, or I can't use it. So what we're focused on from an engineering standpoint is creating a differentiation between ourselves and everybody else, where we're going to use our own agents to read the data and serve it up in a format that physician who's got minutes can actually make a good clinical decision.
So just maybe getting more deep into an area that you may or may not want to talk about, but you've done this like 10 times roughly, and you weren't out looking for a job.
So I was retired.
You were retired, enjoying, that other type of lifestyle.
All of them now.
golf in the mountains, and all of a sudden this comes up, you're on the board, and you decide this could actually be the answer to this interoperability problem that you have been focused on for decades, I've been focused on for decades, and now here you sit in potentially that moment where we look back, multiple lifetimes from now and realize like this was the time when all of a sudden things changed. Is that right?
You've got, Secretary Kennedy, you've got Dr. Oz, you've got Bruce Planck, you've got Amy Gleason and Doge. And the other guy, somebody else on the team, said, I just had that with my father in Atlanta. So he's in Atlanta. I went to get his medical records. They gave me a CD of the images.
That's crazy.
Now,
So
images aren't necessarily flowing, by the way, to be clear, over the network today. But all the other stuff is.
yeah.
We'll get to the images.
Yeah, that's what I was going to ask actually, is when you brought up the images, my perception was that that wasn't yet flowing, you should put it. But that's part of the overall design goal, is to have images as well. And so what's the limiting factor that's preventing that?
Vendor issues. So there are constraints. So let's focus on what we can do today.
Right.
And be really damn good at.
Yeah.
That's what I'm trying to get our teams to do, and with the support of our clients who are fabulous.
Yeah.
Let's clean this up. Let's get this going.
So you talked about in the electronic health record world, that's one of those customer profiles. And Meditech, I think you mentioned,
Yeah.
they're leveraging Health Gorilla. That's their underlying fabric for interoperability. So does that allow a Meditech hospital or clinic or provider to connect up really with anybody else that is on, whether they're on Epic or Cerner or whatever?
Well, that's the idea. That's
Okay.
100% what happens. Plus, part of our business model is we connect all the legacy networks plus the keywords.
Okay.
So you're getting a very robust data set that we're cleaning up before we give it to the doctor.
Got it. Okay. That's interesting. So it's such a fantastic story, and it's great to hear directly from you that you see the traction and the potential.
Absolutely.
Because heck, how many different things have come out where people say this is going to solve interoperability? I remember when HL7 first became popular as this is going to solve interoperability. It sounds like you're really onto something that is going to actually make a big difference.
I think with a little help from the government, not that I'm a big fan of sticks.
Well, I agree with you. And I think you're in an extremely good position to make a big, big difference. And I'm happy that you're out of retirement working on it.
Thank you.
So, well, thank you so much for being on Boombastic
for
Health. Really great to hear the update and great to get to know you. I'll look forward to keeping the lines of communication open.
Great. Thank you very much.
Awesome. Well, hey, thanks everybody for being here for another episode of Boombastic Health in the Wild.